Growing up, I never really had the conversation about periods or fertility, and throughout my 20s I had absolutely no idea that age is such a key factor in my own fertility. Male and female fertility does both decline with age, but it is far more significant in females, with a sharp decline by the time you're 35. I had absolutely no idea about this. It does affect men too, and sperm does decrease over time. There are, of course, treatments, but they can't turn back the biological clock, and they become less effective over time. So consider age when thinking about your future fertility.
Sexually transmitted infections such as chlamydia or gonorrhea are extremely common, but often have no symptoms at all. If left untreated, they can have lasting impacts on your health and affect your future fertility. In women, it can lead to something called pelvic inflammatory disease, which is actually a major cause of infertility in women. And for men, it's the inflammation of the testicles. So if you are having sex, you need to be aware of these possible STIs. Wear a condom, get yourself tested, and protect your future fertility.
So many women don't realize that the BMI is very important to their fertility. It really helps to keep your body weight within the normal range, so that if you have problems to conceive, then you can access help sooner rather than later.
Everyone knows that binge drinking and drinking a large amount of alcohol is actually really bad for your physical and mental health. However, not many people actually do know that it's also bad for your fertility. Your sperm and your egg production is affected due to binge drinking and abusing alcohol. And because of this, basically, your chances of being able to conceive as an adult when you're older, they've been reduced. And not only this, you also find it hard to keep it hard in the bedroom.
We all know smoking is bad for us, but didn't know it can affect your fertility. I'm Kevin and I'm 35 years old, and I wish I knew that 10 years ago. For us guys, smoking may reduce sperm quantity and quality. For women, smoking reduces the number of eggs, can disrupt ovulation, increase rates of miscarriage, and can cause an earlier menopause. If you smoke, stop. If you don't smoke, don't start. Your health and your fertility will thank you for it.
Did you know smoking marijuana can affect fertility? Also doing recreational drugs such as cocaine. It can lower sperm count and it can disrupt ovulation. I thought you should know.
I understand taking anabolic steroids does have perks, but without knowing the side effects, for instance, it can lead to having kidney failure, liver damage, it can lead to having a stroke or even a heart attack, and also it can make you infertile. And for the guys, it can also make your balls shrink. I don't want that to happen, so I don't take them. Don't take drugs.
I heard that anorexia isn't just an eating disorder, it's also a mental health condition as well. It can have long-lasting impacts on your health and fertility, and can even cause women to miss their periods or stop them altogether. There's also growing evidence that bulimia has been linked to PCOS or polycystic ovary syndrome, which can cause the ovaries to fail to ovulate correctly. I didn't know that. Did you?
Most girls have some pain or discomfort before, during, or even after their period. That's completely normal. However, it's not normal to have consistently irregular, very painful, or very heavy periods. If you're finding this is affecting your everyday life, don't just put up with it. Go and talk to your GP. And for the guys, if you notice any swelling, any lumps, or enlarged veins in your scrotum, it's important you talk to your GP about it too.
Your fertility, you can be wild and free. Your fertility, and still behave responsibly. Your fertility. fertility.